So thank you all very much. Thank you, John, for inviting me, and it's truly a pleasure to be here. I want to start by, how does this work? Press the next.
Should be, yeah. And Brian or Ray.
There we go. Oh, nope, it went away. There we go. I want to first thank the City of Dublin for their warm welcome yesterday. I'm staying at the Shelburne. We had a fire. And so we were outside for like 90 minutes with all the finest firemen and a few policemen and the fire brigade and the EMS. And in addition, you brought out Henry Winkler, so I got to chat with him for a bit. So it's really been quite an interesting foray into the city of Dublin. So thank you. But seriously, I want to start by saying I am not a healthcare professional. I don't even play one on TV. What I am is a business developer and a technologist with a deep passion for healthcare. And so it is truly a pleasure to be surrounded by people who are like-minded, who are trying to improve how we deliver healthcare. I have that QR code that goes directly to my LinkedIn profile. So if you want to continue the conversation outside of today's activities, would love to connect with you. So as John said, my day job is to be part of the global program that we have for Microsoft for Startups. I lead specifically healthcare and life sciences. And this program is designed to help early stage companies from ideation all the way through to product market fit, help build their company and their solutions using our technology. It is free and it's open to anyone. So if you, in your work, have an idea and you think you're gonna spin out some IP, go to startups.microsoft.com and let us help you. Within the Startups program, we have what we call the Pegasus program. This is where we curate a very small set of startups from key industries like health and life sciences, where we do deep technical engagement and deep go-to-market work. And the reason why is because we act like a VC. We want to find those really pivotal, transformational solutions and accelerate their growth. And just to give you a bird's eye view of the health and life sciences Pegasus portfolio, and then I promise the commercial ends, these are the companies that I'm working with today. And those 4 areas around the circle there, those are kind of how Microsoft thinks we can improve healthcare and life sciences. And then I've plotted all the companies in my portfolio against those 4 areas. And I'll be talking about a few of these later on in my discussion. And then finally, if you want to be part of like thought leadership, roundtables, VIP events associated with the Pegasus program, another QR code, yes, we love QR codes, that you can hit to join the conversation through that program. Okay, so let's turn our attention now to the real reason why we're here, how we can think about AI as it relates to longevity. So I wanted to start with kind of a foundational slide, some of the trends that we're looking at. And of course, through the morning, a lot of these have already been touched upon. But, we do have a large majority of healthcare executives that think AI and technology will help transform the industry. However, there's another study commissioned by EY that was conducted by a company called Atomic Research, that's Atomic with a K, where 96% of the several hundred healthcare executives that they surveyed agreed that AI and technology will help them in their daily work. Same survey, 76% of those said, yeah, we're not seeing the returns yet. So we still have a lot to do. We all know about the shortage in the US. We are seeing a slight uptick in the number of people applying and going to medical school and nursing school, but the answer is not necessarily just more people, it's also technology, as I think everyone would agree. We're looking at savings just in medication, dosing, and adherence of a potential of $150 billion. That's huge. And of course, the pharmaceutical industry continues to grow. Patients' dissatisfaction. So this goes to the idea that, for several years now, we've wanted to do away with, I don't know, waiting rooms, have people access their healthcare like they access their bank accounts. All of these things that we're eager to see happen in healthcare. And part of this, of course, comes from the fact that we now have a generation of people that were digital natives. And so in the US, more than half of people under 30 have no primary care physician because they value convenience over a relationship with a particular provider. So this is kind of an indicator of what we need to think about as an ecosystem when we think about not only treating but preventing disease and how we reach these people that want to be a digital first kind of generation. And then, we're all thinking and working towards value-based care, but we don't have the data infrastructure. We talked about blockchain, we've talked about AI, machine learning, all those things. But the infrastructure still does not exist to allow us to put together a holistic approach to value-based care. So we're inching toward it, but we still have a lot of work to do. So you in the room, you're longevity experts. I wanted to share these particular data points because these were the points that I kind of came together and thought about in preparation for today's presentation. So Kennedy was just talking about lifespan versus health span. The fact that, in a few years we'll be at 80 in the US, but only 67 healthy years. I mean, my father-in-law was in essentially a vegetative state for 6 years. And they say in the obituary, well, he died at 84. No, he died 6 years before that, really. So anyway, I wanted to point these out just because this was what I thought about when preparing for today to talk to you. There is, a nice little glimmer of hope there with the sub-Saharan Africa increase, but that's mostly due to fewer children dying, which, when we think of longevity, we kind of think of the later stage, but it starts at an early age. So how do we think about this? And I think Jasmine and Kennedy are really good examples about the molecular level. Like what do we know about all the omics and how do they inform this personalized approach to medicine and longevity? We think about predicting future disease states. Now, my husband and I, so I'm 62, he's 56. We've already gone through like the cognitive testing to see where we are as far as potential for dementia and all of that, because he had a parent die from that and I had a parent die for that. So what are we learning and what are we doing to understand our risks as we move forward? Personalizing treatments for chronic conditions. Now, there's a really interesting study going on between Cone Health, which is in North Carolina, which is where I live, and Abbott Diabetes Care. They are giving continuous glucose monitors to Medicaid patients, so these are patients that are on the lower end of the socioeconomic ladder, and people with no insurance. And the idea here is that these people may not be diabetic yet, but on the course that they're on, they probably will be. So this is an opportunity to educate these people every day while they're at home, while they're doing their regular activities, and let them see when they have ice cream what that does right before they go to bed, no, increasingly worse, and what it does to their blood sugar. It's fabulous. And so I'm really pleased to see these types of things being implemented because it's informing how people think about their health. Fostering wellness practices at all age. It starts early, we know that, getting our kids in sports and all of that. My parents never exercised, never a day in their lives. I've been exercising as an adult in my 20s, and my daughter now follows suit. So how do we not only do that as providers, but how do we instill that in the home? Improved access to underserved patients. I think the Cone Health one is a really good example. And then developing new drugs. Everyone's seen the new drug from Eli Lilly. Starts with a D. The names of the pharmaceutical drugs I can never pronounce. But it's actually not dealing with the symptoms, as you know. It's dealing with the root causes, looking at amyloids and trying to avoid that and reduce that toxin. So lots of good ways to think about how we are using technology, how we can be really creative in applying that technology to improve health. Excuse me. So now I want to turn from the big picture to some actual examples. 3 of these are companies that I work with today, and 3 are companies that I admire from afar. So the first one is Healthy. And of course, they have AI at the end of their name, because doesn't every startup? So Healthy is out of Australia. And one of the things, oh, thank you. Wow, the service here is really good. The fire chief, Henry Winkler, the Fonz. Okay, so Healthy is out of Australia. And their solution has already been approved by the Australian government, and now they're working towards approval both in Europe and the US. But what they are doing is they are bringing health to your phone in a very interesting way. So the first way is that they are trying to respond to people's desire to be more preventative in their health. In the US, we send our kids to well checks, and then they turn, like 13, 14, no more well checks. We do well checks at, the other end of the spectrum, but in between, when we're developing these habits that will affect us for the rest of our lives, we really don't do well checks. The other thing I want to say is that if we all did well checks, we'd break our systems, right? There's not enough people to do that. So this is stepping into the gap. And I know I'm not a medical professional, but I'm one of these 700,000 times a minute going to Dr. Google and going, so what does this mean? Like, I feel, is this sciatica or what, all that stuff. And it's bad, it's really bad. And the large language models also, take it with a grain of salt. But this is really not what we want to do with our healthcare system. What we do want to do is get a solution that we all carry every single day. And the other thing that's great about this is that in less developed countries, they leapfrogged. They went from no phone to cell phones. We went landlines, voice over IP, all this stuff to our cell phones. They go directly, so this actually has a big access element to it. But it's on the mobile phone, it's super cheap, they're working towards having it easily integratable with like all the EMRs and all the other systems, and it's super refined with a dose of AI. So I don't know if this is going to work, AV guys, so hopefully this will. But I've got a video. So this is a video that shows the process of getting those biometrics. No, it didn't. Oh, is it going? There it is. OK. So this is Nick Segal. He is the developer of this particular technology. He's the CTO at Healthy. And what he's doing, this is basically a video of his cell phone. He's looking into the camera, and it is generating his biometrics. Now, a couple of things to remember. It works, it has been tested and works on all skin type. He's Indian, British. It does no facial recognition. So it's not looking at his face, it's not measuring his face. All it's doing is using computer vision to look at the blood flow under the skin. There are his biometrics, everything is great. And what's interesting is that he did this during COVID when he was sick with COVID, and we had his normal readings as comparisons, and it was significant. So it was really, really interesting. So the other thing that Healthy offers is a way to respond to the biometrics. So if your stress level is high, it will kind of talk you off the ledge and give you some options. It will also say, hey, these readings are out of sync for you. You probably should go see your doctor. So it's not really like this personalized engine. We'll get to that in a minute. But it's more about triage-y kind of things. And I know that's not a word, but I just made it a word. So heart rate, stress level, blood pressure, cough check. This was born, obviously, out of COVID, where there are lots of opportunities to analyze coughs using audio systems. Skin cancer, again, this is a triage thing, like go see your doctor. No, that's a bug bite. And STIs. So really, really interesting and a great way to think about access and how this affects long-term health. So if Healthy is giving you the biometrics, Cusin is helping you stay on course. Now, Cusin is out of Seattle, Washington. It's founded by a group of guys and they are guys, that are serial founders, which is always really interesting. And what they do is they personalize your relationship with your health condition. So think of this as kind of a nudging engine, helping you stay on track with your medications, with your exercise, with how you eat, when you eat, how you sleep, all of these aspects of your life and how it affects your health. So if I recently went to the cardiologist who said, you're doing great, but you need more cardio activity. So she gave me an exercise prescription. So it helps, it would help me stay on track with that. So here's kind of a little visual of the pathway and this personalized engine for health. So the way they've worked it is you could do a cohort. Let's say you have diabetes patients that are also trying to stop smoking. Well, there would be a program for that population. Or you can go down to the personalized level. It's that scalable and that malleable. They have a strong relationship and a contract with the government of Singapore. So everyone saw the blue zones. I imagine everyone saw the blue zones. Singapore is one of the areas highlighted in that. And so the Singaporean government is literally infusing this into the kind of the citizenry of the entire country to help them move more, eat better, and all of these things. So they've seen an increase of about 30% of their people getting more steps and exercising more. That's huge. Now, us in the United States, we're not like that, and we're not government funded, and so this would never work, but it might not at the global level, but it can work at a provider level, at a hospital level, or a hospital system level. One of the things about our democracy is it gives us the opportunity to be mediocre. Anyway, so here are some of the, that's your option. So the use cases are there on the left side. But what I wanted to point out here is that this is and has value for all of us in the ecosystem. Certainly you see the value as a patient. But this gives payers an opportunity to reduce costs. Wonderful. It gives providers a way to scale as well as reduce readmissions and lower costs, but increase, hopefully, patient satisfaction. Do you know, we have you do know that we have an obesity epidemic in the US. Do you also know that studies have found that overweight doctors do not talk to their overweight patients about their overweightness? I see it, I understand it, but it's not very helpful. And then, of course, the pharma folks are always looking for ways to make sure that our patients are staying adherent to their medication protocols. So, backtracking just a little bit, we have Healthy, which gives you the biometrics. We have Cusin, who gives you your personalized pathway to better health. And one of those areas, of course, is food. And Sifter is a food as medicine organization, again, based out of the US. 1 in 3 adults struggle, I struggle with speaking sometimes, struggle with obesity. 1 in 5 children in the US, that's terrible. It's terrible. But 85% of our spending goes to managing food and obesity-based chronic conditions. Now, personally, I think that's probably our food sources. I think it's our lifestyle. I come here and people go, oh yeah, you can walk there, it's a mile. If I said that back home, they go, walk, I'm gonna get in my car, what are you talking about? Every time I come to Europe, I'm so happy. Anyway, so 85% And then 85 million Americans have some sort of disorder that they need to figure out what foods work for them and how they avoid them. So this is where Sifter fits in. So these are 5 use cases that I'm showing here. But what I want you to take away is that an organization like Sifter is working right now with retailers, and the reason why is because they're a smart startup and they're starting with an unregulated industry where there's a direct relationship between spend and the customer's increased revenue. So, if you go in and buy chips, it's a lot less expensive than buying a really good quality piece of chicken. So anyway, so they're focused on that, but they're moving into healthcare, and I'm helping them with that. But some of the use cases that they're focused on are food allergies, digestive areas, IBS, Crohn's disease, celiac disease, those types of things, and working with partners to ensure that those partners' customers are getting access to the food that they need. Now, going back to my father-in-law before earlier, actually I've had 2 father-in-laws, so this is the second father-in-law. So this father-in-law was getting a card, a debit card, that was being added $175 a month so that he could buy his insurer, because he was Medicaid, so he could buy healthy food. So it wouldn't buy beer, wouldn't buy cigarettes, wouldn't buy candy, but it would buy organic chicken, fruits and vegetables, and that kind of thing. So those types of incentive plans is the way that Sifter is going to market. Now I want to share 3 startups that are not in my portfolio, and I don't have their decks, so I'm going to tell you a little bit about them. These are all about improving access, and when we are able to connect with people who are underserved, we hopefully make them healthier and last longer, productive, healthier lives. So Fabric Health, love the name, love everything about them. They are standing up little clinics in laundromats in underserved areas. In Philadelphia is their first location. So you go to the laundromat and you sit there for 2 hours. You read a book, you watch videos, whatever. Well, now you go in to some of these in the Philadelphia area and you can have your blood sugar tested. You can go in with a cold while you're doing your laundry and say, hey, is this bronchitis or whatever? It's fabulous and I love it. And it's so clever because it's going to where the patients are instead of trying to bring them to you. Medically Home. So this is another US company, and they are doing the hospital at home. Now, we were just talking just a minute ago with Kennedy about the idea of mental health and its effect on long-term proper health. And Medically Home is going into homes and bringing things like kidney disease, dialysis, cancer care, all of that in the home so that people can stay home and avoid hospital-acquired infections, be surrounded by their loved ones and their dogs and cats and all that, so that they are mentally more equipped to deal with the illness and then live, hopefully, a very productive life afterwards. So great story there. And then the final one is Dispatch Health. These folks started as an adjunct to the EMS services in Denver. And what they were doing, and their thesis is that, look, if an ambulance shows up at someone's house, it doesn't mean they have to be ported over to a hospital. And so they started by going in as EMS type people and going, oh no, they're providing higher level care, not just the EMTs, and I'm sorry, the EMTs are wonderful, I'm not disparaging them at all, but going with nurses and doctors so that they can go on site and go, oh, you don't need to go to the hospital. I have everything I need in my black bag to care for you here, deal with this acute situation, and then get you on your way right here at home. It's a brilliant model. They're also starting to do the hospital at home work as well. But basically, it's a technology-infused way of the family doctor that used to come to your house back how many years ago. So it's really, really wonderful. And I think these types of things where you're getting people where they are and helping them in meaningful ways to deal with either an acute or chronic condition is going to have transformative effects on long-term care and longevity. So I want to thank you for your time and attention and for inviting me today. Please do connect with me on LinkedIn so we can continue the conversation. And if you want to check out the book, self-promotion, sorry, got to do it. There's the QR code for that. And thank you.
Thanks, Diane. That was wonderful.
Okay.
Have a seat there.
Yep.